Which of the following is not a category of behaviors commonly observed in youth with conduct disorder? Is it A, physical aggression, B, excessive crying, C, destruction of property, or D, thefts or acts of deceit? The correct answer is B, excessive crying. Conduct disorder is characterized by a set of enduring behaviors in children or adolescents commonly involving aggression and violation of others' rights. There are 4 categories of behaviors associated with conduct disorder: physical aggression or threats of harm to people, destruction of property, theft or deceit, and frequent violation of age-appropriate rules. Now, while excessive crying may be distressing and indicative of other issues, it's not typically a defining behavior of conduct disorder. Question 2. According to the DSM-5 criteria, how many persistent specific behaviors of conduct disorder symptoms are required for a diagnosis? Is it A, 2, B, 3, C, 4, or D, 5? The correct answer is B, 3. According to the DSM-5 criteria, a diagnosis of conduct disorder requires 3 persistent specific behaviors out of the 15 conduct disorder symptoms over the past 12 months, with at least one of them being present in the past 6 months. This means that to meet the diagnostic criteria for conduct disorder, an individual must exhibit a pattern of problematic behaviors over a significant period with a minimum of 3 specific behaviors meeting the criteria. Question 3. Conduct disorder is often associated with which of the following psychiatric disorders? Is it A, bipolar disorder, B, schizophrenia, C, ADHD, or D, obsessive compulsive disorder? The correct answer is C, ADHD. Conduct disorder is associated with many other psychiatric disorders, including ADHD, depression, and learning disorders. This association suggests that individuals with conduct disorder may also present with comorbid conditions, including ADHD. Question 4. According to the DSM-5 criteria, when must truancy from school begin to be considered a symptom of conduct disorder? A, before 10 years of age, B, before 13 years of age, C, after 16 years of age, or D, after 18 years of age? The correct answer is B, before the age of 13. According to the DSM-5 criteria, truancy from school is considered a symptom of conduct disorder if it begins before 13 years of age. This specific age requirement is crucial for the diagnosing conduct disorder as it helps distinguish between normal adolescent behaviors and those indicative of the disorder. Question 5. What is the minimum duration of specific behaviors required by the DSM-5 criteria for conduct disorder diagnosis? Is it A, 3 months, B, 6 months, C, 9 months, or D, 12 months? I mentioned this a couple of questions ago. Did you get it? The answer is B, 6 months. According to the DSM-5 criteria to diagnose conduct disorder, the specific behaviors must persist for at least 6 months, with a minimum duration of one of the behaviors occurring within the past 6 months. This duration requirement ensures that the problematic behaviors are persistent and not merely a transient or situational occurrence. Question 6. Which of the following is not a behavioral pattern associated with conduct disorder? A, aggression to persons or animals, B, destruction of property, C, excessive concern for performance, or D, deceitfulness or theft? The correct answer is C, excessive concern for performance. In conduct disorder, individuals typically exhibit behaviors such as aggression to persons or animals, destruction of property, deceitfulness or theft, and multiple violations of rules. These behaviors are often categorized by a disregard for the right of others and societal norms. However, excessive concern for performance is not typically a characteristic of conduct disorder. Question 7. Epidemiological surveys indicate that geographical locations represent a broad range of different cultures are not associated with significant variability in the prevalence rate of either oppositional defiant disorder or conduct disorder. True or false? The correct answer is true, and here's why. So epidemiological surveys which study the distribution of determinants of health-related conditions within a population have consistently shown that the prevalence rates of ODD and conduct disorder do not vary significantly across different geographical locations representing diverse cultures. Question 8. Which of the following is not a characteristic of individuals with conduct disorder qualifying for a specifier with limited prosocial emotions? A. Lack of remorse or guilt. B. Callous lack of empathy. C. Excessive concern for performance. Or D. Shallow or deceitful affect. The correct answer is C. Excessive concern for performance. Here's why. The specifier with limited prosocial emotions in conduct disorder as defined by DSM-5 requires the individual to exhibit a persistent interpersonal and emotional pattern characterized by at least two of the following: lack of remorse or guilt, callous lack of empathy, unconcern about performance, and shallow or deceit affect. So let's go over the why the others are not correct. So lack of remorse or guilt. This is indeed a characteristic of individuals with conduct disorder who qualify for the specifier with limited prosocial emotions. They typically lack remorse or guilt for their harmful actions. And then B, callous lack of empathy. Similarly, individuals with conduct disorder often demonstrate a callous lack of empathy towards others, which is consistent with the specifier with limited prosocial emotions. And then D, shallow or deficient affect. This is characteristic associated with individuals qualified for the specifier with limited prosocial emotions in conduct disorder. Their emotional expression may be shallow or lacking in depth. Question 9. Which of the following statements best explains why very young children are unlikely to meet the criteria for conduct disorder? A, they lack the cognitive development to exhibit complex aggressive behaviors. B, they are inherently less prone to aggressive behaviors. C, they are more closely supervised by adults, reducing opportunities for antisocial acts. Or D, they lack exposure to social situations where conduct disorder behaviors typically manifest. The correct answer is A. They lack the cognitive development to exhibit complex aggressive behaviors. Now, why is this answer correct? Well, conduct disorder involves behaviors like breaking into homes, stealing with confrontation, and using weapons, which require a certain level of cognitive development and understanding of consequences. Very young children, typically those under the age of 6 or so, are still at the early stages of cognitive development. They might not have yet had the capacity to plan and execute such a complex aggression. Now let's consider the incorrect options. Option B suggests that the very young children are inherently less prone to aggressive behaviors, which isn't necessarily true. Aggressive behavior can manifest at any age, but the complexity and the severity of these behaviors may vary based on cognitive development. Option C implies that supervision by adults prevents young children from exhibiting conduct disorder behaviors, which doesn't fully explain why very young children are unlikely to meet the criteria. And then finally, option D proposes the lack of exposure to social situations is the reason, but this doesn't address the cognitive aspect of behavioral development. What is a common characteristic of adolescents with conduct disorder in terms of concealing their antisocial behavior? A, they often make exaggerated efforts to hide their actions. B, they are typically unaware that their behavior is considered antisocial. C, they make little effort to conceal their behavior. Or D, they are skilled at manipulating others to believe that their actions are justified. The correct answer is C. They make little effort to conceal the behavior. Now, why is that? Well, some adolescents with conduct disorder may not bother to conceal their antisocial behavior. This lack of effort to hide their actions suggests a certain level of indifference or disregard for societal norms or consequences. Essentially, they may not see the need to conceal their behavior because they may not fully grasp or care about the repercussions. Now let's consider the incorrect options. Option A suggests that they make exaggerated efforts to hide their actions, which doesn't align with the description of conduct disorder behavior. These adolescents are more likely to exhibit defiance and impulsivity rather than calculated attempts to conceal their behavior. And then option B, that proposes that they are typically unaware that their behavior is considered antisocial, which is not accurate. Adolescents with conduct disorder are often aware of societal norms, but may choose to disregard them. And then option D suggests that they are skilled at manipulating others to believe that their actions are justified, which may be true in some extent, but it doesn't directly address the question of concealing their behavior. Question 11. Which of the following family situations is commonly associated with children diagnosed with conduct disorder? A. Harmonious and stable marital relationship. B. Parents surrogates absent from family dynamic. C. Parents with lower rates of antisocial personality disorder or alcohol use disorder. Or is it D. Severe marital disharmony and disagreement about child management? The correct answer here is D. Severe marital disharmony and disagreements about child management. So when the evaluation of family situations often reveals severe marital disharmony, which initially may revolve around disagreements about how to manage the child. This suggests a tumultuous family environment, which can significantly contribute to the development and exacerbation of conduct disorder in children. Now let's address the other options that are not quite right. Option A, harmonious and stable marital relationship, contradicts the severe marital disharmony that's typical. And option C, parents with lower rates of antisocial personality disorder or alcohol use disorder, is incorrect because the parents of children with conduct disorder, especially the father, have higher rates of antisocial personality disorder or alcohol use disorder. So understanding the familial context is crucial in comprehending the development and manifestation of conduct disorder, making option D the most appropriate choice in this scenario. Question 12. Conduct disorder is most often associated with which of the following? A. Ideal parental discipline characterized by consistency and supervision. B. Excessive conformity during pre-adolescence and adolescence. C. Active encouragement of delinquency by the mother. Or D. Early problems such as mild behavior issues, anxiety, and depressive symptoms. The correct answer is D, early problems with mild behavior issues, anxiety, and depressive symptoms. This choice aligns with the characteristics commonly associated with conduct disorder, including early indicators like mild behavior problems, anxiety, and depressive symptoms. Conduct disorder often manifests in childhood, and these early signs can provide crucial insight into its development. Now let's address why the other options were incorrect. Option A, ideal parental discipline characterized by consistency and supervision, is incorrect because paternal discipline patterns are rarely ideal, ranging from harshness to inconsistency or relative absence of supervision and control. And option B, excessive conformity during pre-adolescence and adolescence, doesn't reflect conduct disorder specifically. Rather, it may pertain to general social behavior. And then option C, active encouragement of delinquency by mother, is also off the mark, as while the mother may protect the child from consequences, there's no indication of active encouragement of delinquency. Question 13. Which statement best describes the behavior of aggressive children with conduct disorder during the evaluation interviews? Is it A, they openly express trust in the examiner and readily admit to their problem behaviors? B, their hostility is directed solely towards adult authority figures? C, they often become suspicious and angry about the source of the examiner's information? Or D, they typically display sustained advantages with peers and authority figures. The correct answer is C. They often become suspicious and angry about the source of the examiner's information. Aggressive children with conduct disorder that show this aggressive behavior during the evaluation interview, confronted with their problem behaviors, these children may become more suspicious and angry about where their examiner obtained their information. This reaction reflects their lack of trust in authority figures and their defensive stance when questioning about their actions. Let's review the incorrect ones. Option A, they openly express trust in the examiner and readily admit to their problem behaviors. That contradicts the passage, which describes a pattern of denial and defensiveness among these children. Option B, their hostility is directly solely towards the adult authority figure. That's too restrictive. The child's hostility extends beyond adult authority figure to peers and younger children. And then option D, they typically display sustained advantages with peers and authority figures is incorrect because it's the absolute opposite, as already stated. These children often struggle to maintain positive relationships and may resort to bullying and manipulation. Question 14. Which of the following statements is true about the early preventative interventions for aggressive behavior? Is it A, they have no significant impact on altering the course of aggressive behavior? B, they are most effective when implemented during adolescence? C, they can significantly change the course and prognosis of aggressive behavior? Or D, they primarily target covert symptoms of conduct disorder? Option C is the correct choice here. So it's all about the impact that these interventions can have on altering the course and the prognosis of aggressive behavior. You see, research has shown that starting interventions early, even as early as kindergarten age, can indeed make a significant difference in the trajectory of aggressive behavior. By intervening at this critical developmental stage, we have the opportunity to reshape the path of a child's behavior might take as they grow. Now let's dissect the other options of why they're incorrect. Option A suggests that these interventions have no significant impact, but that's not quite accurate based on the research findings as we've discussed. Option B claims that the effectiveness peaks during adolescence, but the evidence points to the importance of early intervention. And finally, option D suggests that these interventions primarily target covert symptoms of conduct disorder, which isn't quite on the mark either. While addressing covert symptoms is important, the focus here is on altering the overall course of aggressive behavior, regardless of whether it's manifest overtly or covertly. So in essence, option C stands out as the most accurate reflection of the research findings regarding early preventative interventions for aggressive behavior. Question 15. Which CBT-based intervention targets young children from 3 to 8 years of age and includes sessions for both the child and parents? Is it A, Kasdan Problem Solving Training, PSST, B, Anger Coping Program, C, Incredible Years, or D, Making Choices, Social Problem Solving Skills for Children? Option C, The Incredible Years, is correct. The Incredible Years program indeed targets young children from ages 3 to 8, and it incorporates sessions not only for the child but also for their parents. This comprehensive approach recognizes the crucial role that parents play in shaping their children's behavior and aims to equip both parents and children with the necessary skills to manage behavior effectively. Now let's go over the other options. Option A, Kasdan's problem-solving skills training. That focuses solely on teaching children problem-solving skills and doesn't involve sessions for the parents. Option B, the Anger Coping Program. That primarily concentrates on helping school-age children manage their anger and doesn't include the parents either. And in option D, Making Choices, Social Problem-Solving Skill for Children. While a school-based program, it doesn't specifically mention sessions for parents either. So when considering the inclusion of a parent training as a component of the intervention, option C, Incredible Years, emerges as the most appropriate choice. Question 16. Which medication has been shown to be superior to placebo in reducing aggressive behavior in a large 6-month placebo substitution study? Was it A, haloperidol, B, carbamazepine, C, risperidone, or D, clonidine? The correct answer is C, risperidone. So risperidone has been the subject of several placebo-controlled studies specifically targeting aggression in youth with disruptive behavior disorders or mental retardation. Notably, one large 6-month placebo substitution study demonstrated that risperidone was superior to placebo in reducing aggressive behavior. This finding highlights the potential effectiveness of risperidone in managing aggressive behaviors in this population. Question 17. What are some of the common side effects of second-generation antipsychotics? A. Hypertension and tachycardia. B. Muscle stiffness and tremors. C. Sedation, increased prolactin levels, and extrapyramidal symptoms. Or D. Weight loss and insomnia. The correct answer is C. Sedation, increased prolactin levels, and extrapyramidal symptoms. So, second-generation antipsychotics, also known as atypical antipsychotics, have gained prominence in clinical practice due to their comparable efficacy to older antipsychotics, but with improved side effect profiles. However, they still come with their own set of potential adverse effects, like sedation, increased prolactin levels, especially notably when you use risperidone, and extrapyramidal symptoms. Question 18. Which medication is commonly used as an adjunct therapy for conduct disorder to address aggression and irritability? Is it A, lithium, B, clonidine, C, olanzapine, or D, buspirone? The correct answer is C, olanzapine. Now, olanzapine, it belongs in that class of medication known as atypical antipsychotics. It's often prescribed for its common effects and its ability to reduce aggression and irritability, which is a common symptom of conduct disorder. This medication works by blocking certain dopamine and serotonin receptors in the brain, helping regulate mood and behavior. Now let's go over the other options, why they are incorrect. A, lithium. While lithium sometimes is used in the treatment of certain psychiatric conditions, such as bipolar disorder, it's not typically a first-line choice for addressing aggression and irritability in conduct disorder. And then B, clonidine. Clonidine is often used to treat conditions like ADHD or hypertension. While it can sometimes be helpful in managing aggression, it's not primarily prescribed for conduct disorder compared to olanzapine. And then D, buspirone. Buspirone primarily is used to treat anxiety disorder. While anxiety can co-occur with conduct disorder, it's not typically the primary target when addressing aggression and irritability in this condition. Alrighty, all done. As you can see, there is overlap in this with oppositional defiant disorder and intermittent explosive disorder. So go ahead and click on these two videos and learn about them. Thanks!